Hi everyone, my name is Grace and I'm here today to demonstrate how to prepare, draw up, and self-administer your semaglutide injection at home. In the mail, you'll be receiving a large prescription bottle containing both your semaglutide vial and your 30 milliliter vial of bacteriostatic water, along with a bag containing your 5 milliliter syringe that is paired with a 21 gauge needle, 8 sterile alcohol prep pads, and 10 1cc insulin syringes. Our first step is to prepare our semaglutide. So we're going to pop the caps off both our bacteriostatic water and our semaglutide vial. After that, take a sterile alcohol prep pad, use one side to swab the top of your bacteriostatic water and the other to swab the top of your semaglutide vial. Now you're going to take your needle and twist it on finger tight to the top of the syringe. Remove the cap, and we're going to put 3 milliliters of air into our 5 milliliter syringe. After doing so, take your syringe and from a 45-degree angle, bevel up, we're going to puncture the top of our bacteriostatic water. Once it is broken through the seal, you can go down at a vertical angle. After this, you're going to push the air through, and then we're going to gather the 3 milliliters of water. You'll see that the pressure itself should fill it. And we're going to go slightly over 3. After we have the correct measurements, you can remove it from the bacteriostatic water and press up to exactly 3 milliliters. Next, we're going to put our bacteriostatic water into our semaglutide vial. For demonstration purposes, my vial is empty, but yours will contain the active pharmaceutical ingredient. So to do so, just like the last, we're going to go bevel up at a 45-degree angle and puncture the top. Make sure for this one you're hitting the sidewall, and then we're going to inject all 3 milliliters of our bacteriostatic water into our vial. To recap your needle, you're going to place it on your workspace and scoop up the cap like so, and then properly dispose of it into a sharps container or an old plastic jug. Next, we're going to take our semaglutide vial and make sure to swirl the contents. It should be a clear solution in the end. Again, mine does not contain the active pharmaceutical ingredient, but yours will. Now, if you are done with this process, you're going to make sure to refrigerate your semaglutide vial. If not, you can continue on to the next step. To administer a dose, we're going to take an insulin syringe, remove the plunger end cap, and draw up air like you did before. For demonstration purposes, I will be doing 15 units. After doing so, you can remove the cap from your needle and inject it into the semaglutide vial. Once the needle is in the vial, you can press down on the plunger to expel all of the air into the semaglutide vial. Then with the vial between your forefinger and thumb and the other hand holding the insulin syringe, we're going to turn the vial upside down and pull the plunger back to our prescribed amount. The insulin syringe is now ready for self-administration. We're going to use an alcohol prep pad to disinfect the area. You want to choose an area that is about 2 inches away from the left or right side of your belly button. We're going to swab that skin, pinch the area, and then inject the needle straight into it. Push the plunger down, administer the semaglutide, and then you're going to properly dispose of your needle, and you're done.